Let's talk menopause. Menopause is an important milestone in a woman's life. And this series on menopause is meant to create awareness about menopause, understanding the physiology, and how to deal with the issues of menopause. It's all about Eve. Eve being Eve, she has multiple facets to her life and many stages that she evolves through: childhood, puberty, reproductive phase, motherhood, and then perimenopause, menopause, and postmenopause. Each stage of her life, she faces new challenges, and her system and physiology goes through a lot of turmoil. And Eve, strong that she is, sails through all these phases, sometimes effortlessly and sometimes with a lot of effort. I am a medical professional, and today I'm going to take a small pause here and talk only about the big M, that's menopause. You may wonder why I chose this topic. Last year, I underwent hysterectomy, and I have been facing a lot of ups and downs in my physiology and have been facing the aftermath of menopause. Menopause is inevitable in every woman, and it's a physiological, normal phenomenon. In fact, it's a graceful entry into the third phase of life, which marks maturity, seniority, and grace. A lot of us are unaware of what we go through during this phase of life and the major physiological changes that happen in the body that lead to a lot of health issues. And as a doctor, I have noticed that in India, many of us are shy to talk about it. Sometimes we do not know about the problems, or some of us think that it is simply a passive phenomenon and do not complain about it. The knowledge about the problems and issues that come up during menopause only make you face this new physiological challenge in a better way with better understanding of one's own body. As most of you know, we have two ovaries and two fallopian tubes which are attached to the uterus. Each woman during her life produces a fixed number of eggs, and the number of these eggs go on declining till menopause when no eggs are formed. During each menstrual cycle, only one follicle or only one egg matures from each ovary, and this shall form into a pregnancy if reproduction happens. There are three phases of menstrual cycle: the proliferative phase, the ovulatory phase, and then the secretory phase. At the end of the secretory phase, there is bleeding, which we call menstruation. Ovaries produce three hormones, the most important being the miracle hormone of the women called as estrogen, progesterone, and testosterone. The secretion of these hormones from the ovary are further controlled by the glands which are higher up in the brain. Perimenopause is a stage before menopause which can last for as long as 8 to 10 years before woman attains menopause. During this phase, the ovulatory cycle is either prolonged or ovulation becomes ineffective, and gradually the egg production declines. During this time, estrogens either keep rising or attain a plateau, and this leads to the menstrual cycles becoming irregular and manifest into delayed period or sometimes shortened cycles. It can lead to excessive bleeding, or it could lead to very little bleeding or sometimes spotting. At the end of the perimenopause, when a woman stops bleeding for at least a period of 1 year, that's 12 months, then medically we say that the woman has attained her menopause. And that is the end of her reproductive life. and this is absolutely normal. When a woman undergoes removal of the uterus for some surgical reason, for some surgical causes like fibroids, uterine cancer, ovarian cancer, or because of some medical problems like post-chemotherapy or post-radiotherapy, menopause which is attained because of such intervention is called as surgical menopause. When a woman attains menopause before the age of 45, it's called as early menopause. And when a woman attains menopause before the age of 40 years, it's known as premature menopause. During perimenopause, the fluctuating levels of estrogens, sometimes high, sometimes low, are the main cause of all the symptoms. Estrogen is required by the body for the calcium metabolism and helps in maintaining the bone density. Estrogen also keeps vaginal mucosa moist and elastic, and because of which a lot of problems come up. Today, I will try and enumerate most of the symptoms that come up and the women face during the menopause, some of which are vaginal dryness, and because of this, postmenopausal woman experiences vaginal itching, painful intercourse, bleeding during intercourse, and repeated urinary tract infections. Another important sign is hot flashes. Lack of estrogen makes a woman's body extremely sensitive to the changes in temperature. So whenever there is increase in the temperature, a signal is sent to the higher centers in the brain, and this resets the thermostat and gives a signal for our blood vessels to dilate. And because of the dilatation of the blood vessel, the body tries to throw the heat out, and this leads to hot flashes. Chills, night sweats are again some of the symptoms. Sleep problems, which lead to disturbed sleep and insomnia, fatigue and lethargy, mood changes like anxiety, palpitations, irritability, lack of concentration, weight gain and slowing of metabolism, thinning of the hairline and dry skin, skin pigmentation and increase in the facial hair, decrease in the sexual libido or the sexual desire, loss of breast fullness and osteoporosis. I think I have tried to put all of them under one roof. A quick word about depression in menopause. Depressed mood for a brief period of time, clinical depression, depression as a symptom. None of these were related to menopause during various clinical trials. Generally, an overall effect of one's low self-esteem about the body, infertility, sleep disturbances, mood changes, irritability. I think all these culminate into a woman feeling depressed. But if this depression lasts for a long time, I think this individual needs to seek medical help. So in a nutshell, menopause is the inevitable truth in a woman's life, and staying aware of what we are going to face and what our physiology goes through, I think gives a better understanding, and we are better equipped to face this new challenge. I think today, all that I have talked about shall help you to face menopause in a better way. Thank you for watching.